All right, Unit 2, Part 2, Professionalism in the Sleep Lab. Being a sleep technologist requires being a person who can have a decent filter when speaking to patients, being empathetic with patients' individual situations, and someone who can follow protocols to help those patients towards a better end goal. It also requires a tremendous amount of knowledge and know how, eventually culminating into the consummate professional. A profession is a job or a career that takes a long time and specific education to master. A professional is a person that embodies the collection of qualities who is ultimately the best at their job. Professionalism is a set of characteristics that a person must have to do the best job and to continue to help their patients in the best way. When you come to work or school, do you come thinking, great, now I have to be here for so many hours and deal with this person or that person, and it's always such a pain in the you know what? Or do you try and think about the positives? Oh, that patient's coming back in that you liked so much last time. Or that patient's going to come in that's going to be a really interesting learning experience because you have noticed there in their chart they have lots of seizure activity. That's kind of, from our end, that's interesting. If you can shift your thoughts towards interesting things more so than things you despise about your job, people will see that in your work. Your attitude will shape your behaviors. If a wire falls off, you can think, I'm not going in there, or I'm not leaving my taco again. Then your behavior will reflect that by having a wire off during the study. You could also look at the scenario and think, I need to get that wire back on because if she needs to have a perfect study, so I don't have to be yelled at for another night. Or, I need to get this patient the best sleep study because she's so ornery because she doesn't sleep. Appearance isn't everything, but the way you present yourself matters, especially in a professional situation. If you look at your patient like they are weird or strange or they smell, they're going to look at you and feel you judging them. If you're friendly and approachable, the patient is more likely to mirror that behavior. I remember a patient very well because I had her twice, and she was by far the smelliest person I've ever encountered in my life. This includes my daughter, who I still facilitate bowel movements with. But this was rough. It was so bad when I took her into the hookup room, other patients were complaining about the smell. I had to maintain a straight face and hold decorum the whole time. I know some people who, in this situation, would actually ask the patient why they smell, kind of like if your tag was hanging out of your shirt or you have something in your teeth. They want to help you not embarrass yourself, but this was super personal, seems like a chronic issue. Sometimes you'll also walk into a patient's room when they've been on CPAP all night and their mouth's been open. Oh gosh. If it was one nice thing about COVID, it was using masks because those kept some of the stink out. You can't make patients feel bad about themselves. Helping people means helping everyone, even the stinky ones. Along with all the personal traits, professionalism involves an in-depth knowledge and skill set of your field, in this case, sleep. You want to go to school at the best school you can for sleep, and around here it's Pitt Community College. You get your polysomnography degree, so then you can get your accreditation, RPSGT, and practice as a sleep technologist. That's what a professional does. That's a good starting point for your own healthcare skills. After that, you want to improve on those healthcare skills with professional growth. Personally, I went the accreditation and education route. After everything, I studied for the CCSH and then went to UNCC and got the bachelor's with neuro and sleep sciences. In between those areas, I joined NCASM, which is North Carolina Association of Sleep Medicine, and a couple other sleep associations to keep up with news and what everybody else was doing. It helps to have knowledgeable friends in your related field in case you're the smartest one at your lab and you don't know how to do something. You ultimately represent the facility that you work at. The confidence patients have in the healthcare they receive is influenced by every professional that they come in contact with. Sleep technologists have their own guild or association, the American Association of Sleep Technologists, or AAST. This entity is a professional organization that is for everyone who wants to improve their skills or build relationships with other technologists or learn how to collaborate in groups. They may have conventions or special meetings that you can get some CEUs or CECs, continuing education credits or units. These conventions can be a lot of fun, not just educationally, but entertaining. The AASM has big annual conventions too. When I worked in Raleigh, I was frequently reminded about how much fun everyone had in Vegas that one year. These are also places that may offer leadership or management sessions where you can learn to delegate and be a lead technologist or manage a sleep lab. When I went to NCASM summer in 2019, I met many people there. I saw our friend Mr. Spruill there. I even think he was the secretary of NCASM at the time. The lab that I worked at, the doctor who ran it, Dr. Perkins, was actually the president. There were many great speakers, but one that actually got me emotional hearing her speak was Mary Carskadden. I'll always remember hearing her lecture and meeting her out in the lobby, actually. She was like a grandmother to sleep technologists. She was an amazing woman and taken too soon. If you don't know much about her, you should do yourself a favor and find out. In fact, in one of my interviews for a job, when I got out of sleep school, I got extra credit for knowing who Mary Carskadden was, which, she came up, or she helped formulate the MSLT rules. You will encounter difficult situations in the sleep lab. If you can think about all the ways those situations can pan out before they happen, then you have the tools in place to guide you to safety and peace. For example, the problem-solving method. Identify the problem. You have a patient that says she doesn't want to use CPAP. Gather information. Why don't you want to use CPAP? Well, the patient might say, I don't think I can sleep with that. I've seen on what they're like on TV, and my friend says it makes them have headaches, and you have to wash it. Create alternatives for the patient in their mind. So there are a lot of different CPAP masks, and some of them are really small. Sometimes if the pressure isn't right, you can get headaches. Maybe that's what your friend is getting. But, you can get headaches from a million different things, right? Ultimately, you are trying to get better sleep. So let's find a good mask for you to try and give it a best shot. Just think about it when you're asleep, you're not even going to feel it. And remember, this is for your health and longevity. You might just amaze yourself. Use positive words and actions and make everything comfortable and amenable for the patient. Think to yourself, if you were in this patient's position, what would you hope someone would say to you to make you feel comfortable and more confident? If you run into a wall or don't know what else to say to someone, ask a technologist, either a friend or your lead tech or your supervisor. One of the ways you can prove your professionalism is through credentialing, which is a way of recognizing your status as a professional in your field. Sleep technologists get their RPSGT, or Registered Polysomnographic Technologist Credential, which is serviced by the BRPT, the Board of Registered Polysomnographic Technologists. It was founded in 1978, and their offices are located in McLean, Virginia, and is accredited by the National Commission of Certifying Agencies, which is an agency that agentifies agencies. How about that? The BRPT not only credentials sleep technologists, but through the credential process, they're trying to make the standards for becoming an RPSGT difficult and thorough enough to establish a high-quality professional that can follow through with the professional and ethical standards that it takes to be what we want to see in RPSGT. Wow, that rhymes way too much. In order to get the RPSGT, you must have progressed through one of the paths established by the BRPT, either by going to a 2-year sleep school like we're doing right now, working on the job, and attending a cram school. And there are also some old grandfathering ways that you can that can lead to you sitting for the exam. You must provide evidence of your education or training, as well as a set amount of clinical experience hours. Once that's achieved, you can pay the $450 exam fee and schedule your testing session. There are depending where you're at, there are testing centers nearby in Greenville and in Raleigh. Personally, when it was my turn to take a test, I went to the place that had the next available test, which for the RPSGT was in Raleigh, and I actually traveled to Wilmington to take the CCSH because that was the closest place and it was also the soonest that I could get it without having to wait like a whole month or something. The BRPT has registered over 22,000 technologists, but they are definitely not all still active. My number is 21487, so it's pretty high on the list. In fact, one of my advisors in Raleigh has a registry of something like 265, and I think his CCSH was in the double digits, which is very, very early in those programs. So the BRPT is responsible for credentialing technologists. There are a couple other agencies that credential clinical and educational facilities, like the Pitt Community Sleep School. The Joint Commission on Accreditation for Healthcare Organizations is responsible for all standards in hospitals, and the AASM is responsible for facilities like private labs. For educational facilities, there are a couple options, including COARC, which is the Committee on Accreditation for Respiratory Care, which is the parent agency for our sleep school. I think this is because the original director for the sleep program was a respiratory person, but I could be wrong. Or you could also go the Committee on Accreditation of Education for Polysomnographic Technologists. So, this isn't really a particularly sexy unit on educational lectures, but a lot of this stuff will be in the exam on some form. It's in the blueprint if you look at it. So stick with it, my friends, and ye shall prevail triumphantly. We'll see you next time.